Good afternoon, everyone. I am Dr. Vinod Babu. I am a consultant with Dr. Mohan's Diabetes Center, Indranagar branch. Today, FB session, we are going to on this live session, and Q&A is also there. In this session, primarily, let's discuss about the importance of weight loss in management of diabetes. More importantly, type 2 diabetes. This is what we are going to discuss today. So many misconceptions and myths are there with respect to diabetes management. People think that it is something which you can reverse permanently. That is not the case. So let's talk about those. And if you have any questions with respect to diabetes management or weight loss in general, feel free to post it in the comment section. I'll try to include as many questions as possible in this half an hour session. So without much ado, let's jump into the topic right away. So there are different types of diabetes. Diabetes is basically a heterogeneous group, what we call, meaning to say it is a group of disorders. It is not just one particular disease. So it is a disorder where your body's pancreas is not able to produce sufficient insulin. That is what we call as type 2 diabetes. Because body weight is more, the organ size, what is the size of your heart, liver, kidney, is maxed at the age of 21 itself. So when you become an adult or little into the adulthood, your organ size gets maximized, and any further increase in the weight of a person means fat tissue is accumulated more, the organs will be strained, and that is the root cause actually of diabetes. And the most important thing, what determines that a person develops diabetes type 2 or not, is the genetics. It is a predominantly genetic disease. That's why if you go to any doctor, or many of you may be aware that if it runs in your family, you are at high risk. And diabetes tends to come sooner compared to the parents because of the natural lifestyle changes which have occurred over the last 100 to 20 years. The world has developed at a rapid pace, making everybody, it's impossible to stay untouched by the industrialization which has happened over the last 100 years. So the dietary changes which has occurred in the last 100 years are much more, what do you call, they're very, very different. The changes are very, very big compared to the changes in the diet which has occurred over last 3000 years of human beings. So in that way, because of this rapidity of the change in the diet, but the onset of the diabetes has also followed a natural phenomenon of coming 1 decade early. So that is what we are seeing. Most people in urban areas, at least in adults, if you say 25%, 1 in 4 person who is an adult is developing diabetes, because if they would have followed the old kind of a diet, they would have got it much later. That is the reason why we are seeing a rapid surge of diabetics all over the world. So even India is not an exception. In fact, in India, we see more number of patients being diagnosed quickly in the last 10, 15 years. There is this, if you put it in a graph, many of you are familiar with the COVID viral graphs. So the graph has surged like that now because of that. And in the next decade also, India is going to have a very rapid increase in diabetes, because genetically Indians are predisposed. Somebody in your family, or in your extended family, might have these genes. They might not have been expressed in that person because they are blessed with good genes, but when you get half of your genes from your mother and father. So half genes from weak genes from your mother, weak genes from your father were utilized in the making of a person. That person is likely to develop type 2 diabetes, even though there is nobody in the family with the type 2 diabetes. So genetics are tricky. It's a complicated science itself. And diabetes itself is not that simple. Not one gene, multiple genes will determine whether a person develop these diabetes. And even when diabetes comes type 2 also, there are different subtypes of type 2 diabetes that we are researching at Dr. Mohan's Diabetes Center, which even the world is not familiar. So there are even 4 subtypes of type 2 diabetes that we use our AI tool to categorize into, and then predict which medicine actually gives a better response to this patient. So in a nutshell, diabetes is a very complex disorder, and it tends to progress with the time. So it's very hard to see somebody whose diabetes stays like that forever. You take a pill or you achieve weight loss, it will stay like that forever. It progresses just like the way our skin becomes wrinkled, hair becomes gray with the age. With age, human tendency is to put on weight, most of the people. And with that, insulin resistance increases. And because of that, the beta cells also undergo, beta cells means the cells in the pancreas. These cells also undergo apoptosis or programmed cell death, what is seen in other cells, other organs of the body. There are limited number of beta cells, and the beta cells undergo death, and naturally insulin production comes down with time. So we do what we call C-peptide test to determine whether you have good pancreatic reserve or a poor pancreatic reserve. It's like, pancreatic reserve means, it's like a lemon. I would like to describe it to my patients like, you have a lemon sitting on the table which is cut, okay, and you ask the juice to come out, it will not come. If you squeeze it, it will come. So that is what these tablets, what we use for diabetes do. They go and act on the pancreas and squeeze the pancreas, provided it has the juice inside, it will come. In some type of other types of diabetes, I'm talking about type 1 diabetes and autoimmune diabetes, what we call LADA. In this type of diabetes, the lemon is dry, in the sense the pancreatic reserve to produce the insulin, even with the medicines, will be absent. So such patients need insulin from the day one of management itself. So obviously there are some exceptions in both the cases. So nature is not always white and blue, white and black. There are in between several colors. Similarly, there are different types of type 2 diabetes. And even in type 1 also, there are different types of type 1 diabetes. And there are hybrid diabetes, pregnancy related diabetes. So it's very complicated subject. That's the reason it has evolved into its own branch now. So let's talk about the diabetes and weight loss. Why there is why we are talking about this. There is a lot of misconceptions among the public regarding to what extent weight loss can help. So let's restrict our discussion to type 2 diabetes itself, because type 1 and other type of diabetes, weight loss will not have any meaningful impact on the diabetes control of the patient. So what is why you need weight loss? Who is overweight? First, we need to define that. Let us say Indians, we are more susceptible because of the lack of awareness about diabetes. We don't do screening in India. Everybody needs to screen for diabetes, because 90% of the diabetes patients don't get any symptoms. If you're waiting for the symptoms to develop and then look for diabetes, it's already too late, because it does a lot of damage in the first 5 to 10 years, which body, even if you control it after that and maintain it for the next 20 years also, it's not going to have good outcomes later. So heart, eye, kidney diseases will follow. So important, first 5 years, first 5-10 years are very, very important. You identifying it early is very important. So that's the reason. So if it is not causing any symptoms, how are you going to identify it? Annually screening. Both diabetes, BP, cholesterol, these are all chronic diseases. Once you start, this is the nature's limitation upon our organs. And with aging, they become worse. That is how they have been for millions of years. And it occurs in animals also, the same principles. So if you are diagnosed with diabetes, of course, you need to look for it. And if you are diagnosed with diabetes type 2, weight loss, if you are overweight as well, what is the definition of overweight? If your body mass index, BMI, according to your height, whether your weight is more or less. Most of the Indians we see in cities, obesity is 70 to 80%. Even the children are obese these days, overweight or obese. So the BMI criteria is 23. Remember that number and calculate your BMI using Google tool. If your BMI is more than 23, you are obese. But perception is that somebody is lean and they think their BMI is 23 or below. They think that they are underweight. That is the problem. Perception, because all the people around us are having BMI of more than 25 or 30. People think that it is not normal comparing with the other person who is obese. So if your BMI is less than 23, good job. Your risk of heart disease and your risk of kidney disease and diabetes is much less. If your weight is more for your height, then definitely you are at an increased risk of diabetes. You need to screen for diabetes type 2 every year one time. So let us say you're already diagnosed with diabetes and recently diagnosed, and you are overweight. By achieving weight loss, by following a calorie restricted diet, achieving calorie deficit is the way to achieve weight loss. That's the only way. Science works only like that. Science Physics and chemistry are exact, exact sciences, whereas medicine is not an exact science. So law of energy states that in physics that energy can neither be created nor destroyed. So in the same way, a person's weight increases only if they are eating more calories and spending less calories. So these are the only two ways you can achieve, changes in weight can happen. So if you eat more and work less, weight gain will happen. So in order to lose weight, simple, reverse it. Eat less and work more. So simple. Eating less means, eating 2 meals a day instead of 3 meals. Of course, this recommendation doesn't apply to patients who are taking diabetes medicine, which can cause low sugar. We definitely need to consult with your respective doctor in order to make, if you're keen on losing the weight, definitely, the medicine requirement will come down, and then your existing well-controlled diabetes can cause low sugar. So you definitely need to discuss with doctor. So in general, if somebody is desirous of weight loss, the way to achieve weight loss is achieving a calorie deficit. So what is this calorie deficit? How much energy your body needs and how much you are giving to it. So if you are eating 3 meals a day and your weight is constant, that means that the energy that you're taking is spent on the activities to run your body and the activity that you do, whether it's walking, talking, sitting, standing, doing exercise, going to work. All these factors are balanced out. So you have to create a negative balance in this, calorie deficit in this. Let us say your body needs 2000 calories. Eating only 1500 calorie diet will lead to a calorie deficit. So that energy cannot be created, right? So fat cells in the body will burn and produce that energy. That is the only scientific way where you can achieve weight loss, by achieving calorie deficit. And the calorie deficit can be achieved much harder in another way, that is to increase the level of activity. So increasing every day half an hour exercise is important, and if you do more exercise, then you think that you lose to weight, it leads to more weight loss. That is a myth, because it's much harder to lose weight by exercise than by doing dieting. Dieting is the only way. Weight loss happens in the kitchen, not at the gym. So that is the standard sentence. So weight loss and muscle, and even strength training also, you can improve your muscles and reduce the body fat. All those measures will definitely work, but no amount of exercise can offset for a bad diet. So if you think that I'll eat this food today and then I will try to burn the calories later, one glass of milk if you drink, the energy present in it will be enough for your body to do 1 kilometer, 10 kilometer cycling. So 1 hour of cycling, if you do, your body needs the same amount of energy present in a glass of milk. So these are the, much harder to burn calories than accumulating them. So eating less, only 2 meals a day is very easy to follow. Morning and a little earlier in the evening, time restricted feeding during the daytime, avoiding in the night, has been proven to cause weight loss in majority of the patients. So that is what is recommended. And eating, avoiding snacks which are high in carbohydrates, means or fats for that matter, is definitely a way where you can achieve the weight loss. So if you, let us say you follow this calorie deficit method and achieve the weight loss, what next? If you achieve the weight loss, body responds, in the sense the amount of insulin what was produced earlier is the same now also. If you, let us say, in 3 months you achieved 5% of your body weight loss, then for the new body, let's say 100 kg person achieved 5% weight loss and is 95 kgs. For this 95 kilo person, previously whatever was insulin which was produced in the body will be good enough for few months. Again, since diabetes is not a stationary disease which worsens, next year the production becomes 90 itself, 90 units itself. Then the production becomes less. The same amount of insulin will not be enough at that time. So diabetes will progress eventually. That is the main message that you need to know. So there is no permanent cure. This weight loss, any amount of weight loss, 5% to 10%, will definitely benefit your diabetes control. And we always promptly reduce our medicine when we see HbA1c below 7, below 6 for our patients. We promptly ask whether are you having any low sugar symptoms, are you lost any weight, and then try to reduce the diabetes medicine to keep them at a bare minimum. Any doctor's idea about treating diabetes or hypertension or cholesterol is to identify the minimum amount of the medicine that my patient requires, so as to keep them under the target range. So HbA1c target is 6.5 to 7 for majority of the people. BP target is less than 130 by 80. So normal is 120 by 80. We don't want to keep it to normal, at least close to normal, 130 by 80. And cholesterol, if you're having diabetes or hypertension, cholesterol needs to be kept below 70. LDL cholesterol. We're not worried about the other fractions. LDL is the one which has been proven to be associated with blockages in the blood vessels, leading to heart attack, stroke, peripheral artery disease, erectile dysfunction. These are all the complications of arteries getting blocked with cholesterol. So LDL below 70 works well for people with diabetes and hypertension. If you have family history of heart disease, we need to keep it at below 50. So these are what, if you identify and correct them and help patients achieve these targets with the bare minimum amount of medicines, definitely that goes a longer way in adding that extra decades to a person's life. So that is what we always strive as doctors in general, I would say. And regarding this diabetes, so in market there are several companies which have come in recently, which give a false sense of information to the patients that we are going to completely reverse it permanently. But that amount of WHO says that AD, American Diabetic Association, says that we cannot use the word reversal because it gives a sense of false assurance to the patient that it is going to be cured permanently. Not really. Diabetes has been there for millenniums. So it's not going to get rid of. It's a part of our body, organ which is not working efficiently. You cannot make it magically become younger again. There is no technology, or neither it will not going to be there in the next 100 years at least, that you can make an organ of your work like a normal organ. So what we are going to do is, like, you definitely follow the lifestyle changes. That is half an hour of activity, whatever you like, cycling, jogging, dancing, brisk walking, anything, badminton, cricket, whatever you do, be physically active with at least moderate intensity for half an hour a day, half an hour to 1 hour a day. Now, guidelines are changing. Earlier it should be half an hour, now it's 1 hour, 60 minutes a day, at least 5 days a week. And then on top of it, try to cut down the carbohydrates and fatty foods and meet your protein deficit, protein requirement per the day. If you are 100 kilo person, you take 100 grams of protein per day. If you are 70, Akshay Kumar is telling in the TV, same thing. If you meet at least 1 gram per kg of your body weight of protein, that will reduce your hunger. And then you don't take the carbohydrates, chips lying around, snack lying around, you don't eat on them because you are having those cravings. So meet the protein requirement of your body every day, add more vegetables to your diet, and then some carbohydrates. So again, in the carbohydrates, choice is always millets. Millets are better compared to rice, wheat, or ragi. Among the millets, of course, ragi is also a millet, but ragi contains glycemic index. The glycemic index of ragi is more compared to the other millets. So go with Siridanyagal, what we call locally here. So whatever is locally available, unpolished millets are the better carbohydrate source, which contains complex carbohydrates, and then that will lead to weight loss. Of course, satisfaction is less. I am also from South India, where we eat predominantly rice and wheat based diet, but you will be healthier in the long run. Millets are much better alternative to rice and wheat. Rice and wheat contains the high carbohydrates, and they are high GI, high glycemic index. So better to avoid both rice and wheat together. Both are equal, I would say. So it's not like you should swap your rice and then go with that and say that I am doing best with respect to diabetes diet. Both rice, wheat, ragi, all three are considered high GI foods. So all three needs to be cut down to at least 25% of your meal, and 25% protein, and 50% of your diet should come from vegetables. Colored greenly vegetables, legumes, and all the green leafy vegetables, the solid vegetables, everything except potato, maybe. Yeah. So these are the changes you can do to your diet, which will definitely lead to weight loss. The key is to sustain the hunger and don't eat when you feel the craving. Drink enough water. You see myself, keep one bottle here and one more bottle in the evening. So 2 liters of water at the work and then 1 liter at home. So at least 3 to 4 liters. So that, whenever you hunger, don't eat anything, tea, coffee, snacks. All those things will add to the calories and makes it much difficult for you to lose weight. So if you do that, no matter how much busy you are, you follow this kind of calorie deficit diet, and then exercise regularly, at least on 5 days a week basis, definitely, it is you're going to achieve your target weight much easier. And while doing so, you need to do it steadily. Half kg per week is the recommended weight loss. Rapid weight loss is also not advisable. We have good diabetes medicine. Somebody comes to us with a diagnosis of diabetes with high sugars. Today also one patient, young lady came, 25-year-old, little obese, yes, BMI is on the 30, yes, and then the HbA1c was 7.5. So when your HbA1c crosses 6.5, we call it as diabetes. So this patient, what medicine should I give? There are several different tablets. Preferable is to give some medicine which causes weight loss in her, because he must have tried to lose the weight. Weight loss, everybody would have tried. If your BMI becomes 30, it doesn't happen in a day. So we understand that you already put your efforts, but time is of the essence here. If you don't control the diabetes is going to cause complications in the long run for this girl. So what we do, we suggest medication and also reinforce, try to achieve some more weight loss. We have dietitian who will give a specific diet to the patient. My dietitian counsels, I also counsel my patient. Then the patient goes on to the journey, takes the medicine regularly. HbA1c will be well controlled. And if the weight loss also occurs in addition to what is caused by the medication, we have SGLT2 inhibitors which cause at least 3 to 5 kgs weight loss. And we have even a tablet called as GLP-1 receptor agonist category medication, semaglutide, which is working wonders all over the world. That is the drug of the decade, that what they're calling in US and UK. Many celebrities, Oprah Winfrey, Elon Musk, several Hollywood celebrities, they're all using that to lose weight. It works even if if you're not a diabetic. So that is the beauty of it. And we have it in India approved for diabetes patients. And that medicine, taking that pill every day itself, will lead to 5 to 7 kgs weight loss, depending on how you follow the diet. So these medicines make it very easy for you to achieve a calorie deficit diet. And those drugs are going to increase. We are going to get the injectable form in India next year. So semaglutide, and there is one more drug called as tirzepatide. The people can achieve 15 to 20%. Half of the people who take it achieve 15 to 20% of the weight loss. So many more drugs are coming. Side effects are there. Every medicine comes with a side effect. We diligently explain it to the patient before prescribing them. Suppose we are giving SGLT2 inhibitor, the known side effects are urinary tract infection. We ask our patients to drink more water to compensate for it and follow the good personal hygiene, genital hygiene. And similarly, GLP-1 receptor agonist, the common side effect is nausea, feeling like the food is stuck here, and burpings. These are the common side effects. We educate the patients about them. In case if they have it, we are available round the clock. My juniors will be there to handling the emergency line. My staff are available. They can reach out to us, and then we can give them alternate remedy. So the idea is to give the benefits of these medicines, minimize the side effects, because side effects are going to be there irrespective of whichever school of medicine you are going to take the medicine, whether it's Ayurveda, homeopathy, allopathy, or even water. You drink more, it leads to intoxication. So anything in excess is not good. So moderation is the key. Identifying people who are having side effects, and then giving them an alternative to keep the diabetes under control goes a long way in managing the diabetes better. So that's about diabetes and weight loss in a nutshell. It occurs in, think about it. One example I would like to give to my patients during our conversations is a pregnant lady who requires insulin because of diabetes. Once pregnancy is over, insulin requirement will be gone. Why? Because baby is delivered, the fluids are lost. On an average, 6 to 7 kgs loss will occur. Diabetes will not be there from next day. But after a few years, the woman puts on weight, doesn't do exercise, or even if you do that, after some time, the same lady who had gestational diabetes comes back with diagnosis of diabetes. This is seen everywhere. You please inquire around. So the weight loss caused by the pregnancy itself has caused a remission of the diabetes. Remission is the right word that should be used, not reversal. So remission is used there. Remission occurs in natural also in pregnancy. Once the woman loses weight after delivery, the woman doesn't require insulin, and later, but the woman again comes back with increased HbA1c, necessitating other medications to be started. So if your diabetes is under control because of weight loss, it is important for you to monitor your sugars at least every 3 to 6 months. Check a HbA1c or use a glucometer, check it and see where the trend is going. Because even if you follow the diet, it's only a matter of time the diabetes is going to come back. So important for you to know, be aware about that fact. And then when your diabetes comes back, or if the weight gain is occurring, you're not able to follow the soups and salads diet, which is required for intense weight loss. Definitely at that time you need to consider taking the medication. By hook or crook, you need to keep it under control to live a better life, longer life, and healthier life. So with that, we will open the questions now. We will. I hope you have commented. Put your questions in the comments. Let me see. Ms. Ranjit Chekma saying good. Thank you. Mr. Muhammad Munir, those who could not be motivated to exercise, diet control, or lifestyle changes, what options are there for them to reduce weight? Mr. Muhammad Munir, that's an important question. See, nobody can do 100% diet, including myself or anybody. 100% eating healthy, as per the guidelines, it is impossible for everybody to sustain like that forever. So very, very highly motivated person can do that. We are all guilty of, having snacks, eating outside food. We all love it, love to order, eat Swiggy, but that's part of our life now. We cannot completely go and live in a forest and eat only the fruits and vegetables there. So we understand that it's, if you restrict your diet a lot, that will have a negative effect on your mental health and leads to unnecessary stress, and you will not feel happy about your life. So that's where the medications come. That doesn't mean that we should give medicines to everybody who is having high sugars. Definitely do your best with respect to the lifestyle changes, and leave the medicine, leave the rest of it to the medicine. Medicines will take care of it. That's the way, striking that fine balance is the way to live a long and healthy life without complications. Any more questions, please post it in the section, comment section, so I can answer them. We have about 4 minutes left for this session. I know it is a working day in the lunchtime, not many, but at least those who are able to see this message and, hopefully they get some benefit regarding the doubts, the questions that they have, because you Google it, you will have a lot of plenty of people who are trying to dissuade you uh, and give a false sense of security to you. That's how it is these days. So, those who are joined late, I am Dr. Vinod Babu. I am a consultant at Dr. Mohan's Diabetes Center. So, please feel free to reach out to my branch, Indranagar branch, for any queries you may have. My staff will be there. Our call center is there to address your queries as well. Let's work for a better country here by keeping the disease under control. So, when a country is growing in the economic dimension, it's important education and health also are taken care of, so that leads to better dividends in the long run. So WHO, every country is measured on HDI, human development index, has three dimensions. It's not just the growth in the GDP, it's the growth in the life expectancy and growth in the average years of schooling. All three are important, very important to understand that. Yeah, one more question, Mr. Muhammad Munir again. Yeah, those who lost significant but regains again after a few years again, how can this be prevented? So weight loss is occurred by calorie deficit. Weight gain is caused by calorie excess. There are some medical disorders which can cause weight excess as weight gain, but keeping that aside, somebody who's lost weight, they are more likely to rebound in the next 3 to 5 years. So why does it occur? So it is the loss of that motivation which leads to weight gain, and weight gains come back, it's already back to square one. Your diabetes will go for re-reversal, meaning to say it will come back with vengeance. Compared to your previous HbA1c, what you achieved weight loss before, the new HbA1c will be much higher. So you're only buying some time by achieving weight loss. So taking the right medicine will help you prevent the complications like eye damage, heart kidney damage associated with diabetes and hypertension. Hope that answers your question, Mr. Mohammed. So, what is C-peptide assay? C-peptide assay, as I told you earlier in the session, this is the question where this is a blood test, simple blood test we do before food and after food, like our sugar test before food and after food. It will give an estimate as to how much of your pancreas, what is the capacity of your pancreas. If your pancreas capacity is good, the tablets itself will work for such patient. If the pancreatic capacity is poor, definitely you need to think about adding insulin, especially after trying medicines. If you're not able to get the desired response, not able to get your diabetes under control, we don't have any other medication. So for diabetes, insulin is the only gold standard when tablets don't work. So don't wait and see approach is not good there. You definitely need to reduce, consider starting insulin when your doctor advises you to do that. So one more question. Will I gain my weight back once I control my blood sugar? Very high blood sugars leads to weight loss. That is what we call glucotoxicity. That's where your body turns off. When glucose is excess, insulin is not there in the body. Your body is not able to produce the minimum insulin required to get these cells get this glucose into the cells. Body stops using glucose as the fuel, switches to ketones. So that's when the weight loss occurs. When you're having very high sugars, it leads to weight loss. When you give some insulin or start tablets, try to get some insulin production going, then the person gains back that weight. So that's also one scenario, I think, in the advertisement. That is what was mentioned here. So let's get it out of the way as well. So will I gain weight when I control my diabetes? No. So that is only one scenario when your sugars are initially very high to begin with, and your body has turned off, and your urine test shows ketones present. So it can lead to an emergency hospitalization as well. It's a life-threatening emergency, what we call diabetic ketoacidosis. Very important for you to be aware. Don't let your sugars go that high where your body switches off petrol and turns to diesel. So very important to prevent that diabetic ketoacidosis. So, Mr. Varun, how do I check diabetes for my mother? Simple, Mr. Varun. You just need to do fasting sugar, in a fasting state, in glucometer, check it. If the value is below 100, diabetes may not be there. The foolproof way to check is from a lab, from the IV. You take a blood and do the test called as HbA1c, which gives the average of the last 3 months. Because today sugar may be 100, tomorrow it may be 110. That's how glucose fluctuates. And the glucometers that we have right now is not very accurate. The same blood sample, you give it to the same glucometer using another strip, it will show a different value, slightly different value. That's why HbA1c, last 3 months average, gives a better understanding where a person is, whether they are totally normal, whether they are diabetic, or in between, that is pre-diabetes stage. That is HbA1c between 5.8 to 6.4. You will come to know, and then you can implement these lifestyle changes of achieving weight loss if you're obese, regular exercise, before you become a diabetic, thereby avoiding the need for medication for diabetes management. So that's how you check your mother's status. So, Ms. Nandini Pugatai, what kind of food should we avoid if we are obese and lactose intolerance? Mainly, obesity. Why it occurs? Because we are overeating. We are giving more calories to the food body in general. Obesity is a much more complex disease than diabetes. We had several medications coming in from US FDA approved medications, but they quickly got off from the market because of the side effect potential. Obesity, humans tend to become obese with age because of the excess of food available around us, and they tend to eat. You don't know when to stop. You start eating, you're already full. Body doesn't need more than that, but the signaling comes late and you start to overeat. Overeating is the reason for the obesity. So in general, you need to avoid any food containing more energy, means fats. You try to restrict it. We cannot measure the spoon and then say. So if you are somebody, you ask in your kitchen how much oil is being used at home in a month. For one person, one adult, half liter is the maximum that you can use. So there are some people who do vadas and then lots of fries, deep fries and all, but they are not aware that they are taking excess of oil. Total oil consumption should not exceed half kilo per person per month. So if you have a family of 4 adults, you check, with your kitchen, whoever is in charge of the kitchen, your mother or the maid, 2 kgs is what you can use in a maximum in a month, calendar month. So that's a rough way of knowing how much fat you are limiting. And of course, carbohydrates, rice, wheat, ragi, snacks. Practically every snack, every outside food contains refined carbohydrates, maida, and polished rice powder going into making these things, corn flour. All those things contain calories. Carbohydrates, those are the ones which are the reason why we have obesity. Most of our breakfast items are made with these. Most food items, what we call as food, are made up of carbohydrates. limit them to 25% of your plate. If you look at your meal, 25% of your plate only should come from carbohydrates. Increase the protein intake. Protein comes from pulses, soya, paneer, non-veg food, and that again be cautious about the red meat, lean protein like chicken, fish, eggs, prawns. They're all good sources of protein. So ensure that you are meeting your protein requirement every day, and then you minimize the carbohydrates. You will not feel the craving, and that's the way to lose weight. Then mother, Miss Varna, your mother is having leg pain and body pain. That doesn't mean that she has diabetes. You need to screen for it. And even if diabetes is there, it is unlikely to cause leg pain and body pain as the symptom. Most patients don't have any symptoms. So that's the reason you have to check for it. Your BP, your cholesterol, you have to check for it and then determine the treatment in the absence of symptoms. The leg pain and body pain could be due to something else that needs detailed evaluation. Feel free to consult us. And one more, most new graffiting is the name here. Will strength training help in reducing weight? Excellent question. So while when doing exercise, the debate is there, whether cardio, yoga, or strength training. So WHO now says clearly the evidence right now in the some scientific community is that strength training utilizes the biggest organ in the body, that is the skeletal muscles. So if you are a 100-kilo person, your body weight almost 70 kgs is contributed by water is the main 60% of the body is made up of water. If you look at the rest of the tissue, 70% comes from your skeletal muscle. So very important, skeletal muscle needs to be used. If muscle is a metabolically active tissue, if you do the strength training gradually, progressively, following appropriate precautions, that will definitely help in keeping you fit and also healthy. So there is obviously you can't do extremes are not good, not proven to have major benefit. Extremes of exercise is definitely discouraged by healthcare providers. Slow and steady wins the race. So slowly increasing your levels of fitness, whether it's cardio or strength training, maybe 5 days if you're doing strength exercise in a week, including 2 or 3 days of strength training is also very important. Especially after certain age, you tend to lose muscle mass, so it will serve as a hedge to prevent that. Yeah. So, Ms. Danex Jose, my weight is 90 kgs, HbA1c is 7.5. Is it possible to reverse diabetes? I don't like to use the word reverse. Yes, it is possible to reverse, remit your diabetes, remission, achieve a remission of your diabetes if you lose 5 to 10% of your body weight. But don't wait for that don't count on your weight loss to control your diabetes. Consult your doctor, take a medication, keep it under control. If weight loss happens, we can always reduce the medicine later. You should not try to beat this diabetes. It's nature's imposition on our system. So you should try to live with it. That's how you respect nature. That's how you manage your diabetes forever well, very well. Can we go to the gym daily? Yes, you can definitely. Just like the way we walk every day, you definitely can hit the gym every day. But be careful, don't do excess. And you do not know how your heart is. Nobody has got a scan done to see whether everything is okay with the heart or not. So important to slowly, steadily improve your fitness level. Can I walk after lunch? Why not? Anytime. So anytime you can, wherever possible, fit in that extra walking, fitting that taking stairs, fitting whatever, going walking around the park. If somebody asks me to give a talk in Indranagar, I simply go with walking to this office and to give the talk if it is within 2 or 3 kilometers. Even though it takes time, but it serves as my quota of exercise per the day. And some of you who know me, when I should stay 10 kilometers away from here, I always used to come to work in cycle. Cycling is one very good way to commute within the city, provided you take care of safety. And for all the people who are in the age group below 45, you definitely should consider cycling within the city. It solves majority of our problems. So I would highly recommend that to include it. It saves time as well. In traffic, you can easily beat the main hour traffic, and then you would be much healthier in your life. So that's it. I think last question. Thank you for taking up question. Session was. Thank you, Mr. Varna. The idea is to spread this knowledge to as many people as possible, so that they manage their diabetes, hypertension, and life in general, so that life expectancy is much better. So at the age of 65, if you're having all the heart ailments, kidney disease, life is much harder and it's shorter. At the age of 70 or 80, if you're free of heart disease and free of kidney disease, free of your eyes are working well, you're a little bit muscular person, you can do whatever you could do at that age where you could not do in your working age. So very important to live life like that, and then support your next generations as well. If you take care of your health, that's the responsibility, ultimate aim for the society to pass it down to the next generation, the benefits that you enjoyed, your parents, mothers coming and taking care of children. You should be looking to support your grandchildren in a much healthier manner, and then give that advantage of growth to your future generations. All right. Thank you very much for listening to the end. Some of you have listened to the end. But thank you for your patient listening. We'll keep connecting. Please stay tuned to this channel. We'll make several of these live sessions, Q&A sessions, as well as short reels as well shortly, debunking several of the myths that our patients come to us in day-to-day practice. Thank you. Stay tuned. Bye.